And I know that currently, in the past, we used not to have a student conducting the research in the lab. But in this promotion, if I'm mistaken, a student should say the opposite, but we have a good number of students who are in the laboratory research for the undergraduate project. It's a good thing. And we think and we expect to emphasize and to increase the number of students who perform the research in the laboratory on plant, on medicine quality, and on other topic related to lab, linked to the lab. And this is a good way of preparing our graduates to be motivated. And then we know we have a master's in quality control, quality assurance. It's our master's, and we have a good number of students who graduated from our masters, and now they are more involved in their staff of FDA. They are most important element of FDA activities. And this motivate our graduates to follow that research field. And I think it's a good news even for everyone. Thank you.
Thank you so much for that great insight. Then coming back to you, Dr. Inosa. So we've had competence-based learning. We've seen that is one of the modern approach that is being adopted by different universities around the world. And then as an educator, we would like to hear how much of this is being included into pharmacy education in Rwanda, and how do you think this will improve the pharmacy practice in general?
Yeah, thank you. Thank you, moderator. I think competence-based education, this is a concept. We may call it new to us, but it's not new as such, because since really decades, we are seeing many universities, many teaching institutions focusing more on the competences that learners gain throughout the training than just maybe counting years and whatever. So this is how actually you will see that now even some people designing some specific courses to provide people with some skills or competencies to make sure that actually they really learn what they will need to apply in their daily life. So I think as it was presented for at least University of Rwanda, you can realize, in addition to the courses which are well designed and so on, we define also competencies to be gained, or what we expect from our learners at each level, from year one up to the last year. So we make sure that maybe we say at this level, someone will be able to just through our learning outcomes, we focus, or we make sure that we also associate different competencies. So if we think that someone maybe at a lower level is expected just to be able to explain some concept and so on, to understand at a given level in a middle way of the training, we are expecting someone to be able to apply some of those knowledge and concept and theories that we learned throughout the training process. And at a certain level, we expect even more to be able not only to perform or to apply, but also to transfer to others. So we are really considering this in the way we design our curricula, but also in the way we are delivering courses. So this is reason why actually we are having this variety of approaches in teaching. We have some really class-based theories, we have labbers, but also we send students into industries to gain some additional knowledge, skills, and whatever, to make sure they are competent enough in different fields of pharmacy where they are expected to work, or to work on daily basis.
Thank you so much for that comment. Again, you and Dr. Francois and Dr. Inosa, you talked about how we do knowledge transfer, talked about how like pharmacy can use the knowledge transfer to get their skills. And then you also highlighted how pharmacists are now being involved in some of the research. And then as far as the research is concerned, I would like to know implementation of research is one of the tools that is currently being used to enhance pharmacists to uptake the available researches that are online findings and then use them to improve their practices. And then this question goes to all of you panelists. What do you see, like what do you think is missing in pharmacy practice in Rwanda? Why do you think like pharmacists are not uptaking those available resources or just to improve their practice? What is your comment on that?
So let me go first. She will come after. First of all, there is, I remember when COVID-19 started. So people were seeing pharmacy students in France, all over the world and whatever, maybe involved in manufacturing hand sanitizers, doing things like this, like that to help in fighting against COVID. And someone was writing on one group, I don't remember. So can you see what others are doing? Where are our pharmacists? Where are our whatever beloved lecturers and the researchers in pharmacy? So what are they doing? It was like, actually what I want to start there actually, because research really it is something which is a bit comprehensive and complex. And it requires really a lot of, let me say, really, it costs a lot. At least some researches which are very innovative. I know, yes, there's kind of researches which we can do here, but I wanted really to start by there because sometimes you may think that maybe it's a lack of knowledge, it's a lack of competencies, it's a lack of what, but there are really many factors involved in research. So when I come back to maybe what I'm seeing as some gaps in our practice and which can be addressed by research, there are so many. There are so many gaps, and I want just to tackle one of important concept or area. I think maybe you can see it's really emerging all over the world. It's a bit what Dr. Francois was talking about, that the shift is now from product to patient-based. Patient also based, it's really complex because not only you need really to take care of the patient as such, to counsel, to do whatever, but also you need, now the move is to go to what we call customized treatment. So personalized or customized treatment. This is a concept that you can easily understand because it's a treatment which is really tailored to a patient, which really considers the peculiarities of every single patient. And to reach that level, we need sometimes really to have some at least some basic equipment and so on. Because if we really need to define the genetic profile of someone to be able to predict the treatment outcome, including maybe potential adverse drug reaction. I mean, it's their severity, their seriousness. If we need really to consider the metabolism process of someone, this is maybe what you've been understanding all over when we talk about concepts like metabolomics, metagenomics, and so on. So you need really to be at a certain level with regard to labs, some labs, to be able really to apply such kind of concept. But we know that those concepts or those practices are very helpful. So that one of the concepts maybe we've already introduced in our teaching, maybe it's a details, but at least for some students, we learn together now. You know, we've introduced a concept of chronopharmacology, chronotoxicity, chrono whatever, chrono. So this is at least something you can consider to make sure that you help the patient with the same product. This is mainly applied in a cancer treatment, in a chemotherapy. With the same product, you have really quite improved outcome with regard to reducing the side effects, because you know those chemotherapy agents are really very toxic. But just changing the time you administer the drug from maybe morning to just evening hours, you really like prevent the patient to suffer from such kind of adverse events. Those are some new concepts on which we need really to call out research. Yes, it was explored maybe in a cancer, but we can also go to other different treatment, why not HIV and so on, to see what the proper moment, for example, just to administer the medicine, because in most of cases we know that we just maybe have to take 3 times a day, 1 time a day, but what does 1 time a day mean? It's not necessarily the morning, it can be the evening. Some, yes, for some drugs, people may have realized such kind of information, but for many other medication, this is lacking. So I know this is just one concept I'm just tackling, just for those who are in practice to understand that we have really a wide range of fields we need to, in which we need to carry out research to improve our practice, as we are saying, toward modern practice. So I'll give the floor to my colleague, otherwise I would talk and talk. Thank you.
So I think I don't have a really additional idea on what Dr. Innocent said. It's enough. Maybe during the discussion we should have a more additional idea on that.
Thank you so much. So I think now we can have some comments from the audience. Is there anyone who have, I can see a gentleman here. So, can we have a mic here?
Thank you. My name is Ouaouna Janvier. I'm a pharmacy student from level 3. I have 2 questions. First question is addressed to our HOD. I think I followed well, and I found that before, in the level 3 pharmacy, in the curriculum, you had, or we had, in nursing care and first aid as module. And for me, or for my experience, I think it is something which is needed by pharmacists. And so far, there isn't that module. And it is something that, according to me, that should be good if we know such nursing cares and we know how to handle or to offer first aids. So, why did you put aside this module? Or maybe it's because it is needed by pharmacy mostly, but for some who need such information or such knowledge, can you please support RPSA so that can offer such information or such skills to the pharmacist or pharmacy student who wants that knowledge? That is my first question. And my second question is addressed to you both. Why so far pharmacists are not allowed to prescribe a medicine? And that's like A. And as you are moving from basic competencies to more than practice, what things are being done so that in education and the innovation, of course, so that pharmacists can also involve in prescription or be allowed to prescribe a medicine? Thank you.
I think we can take 2 more questions and then you answer. Is there any other question?
Thank you very much. I just want to thank HOD and the Chair of Pharmacy Council for the good presentation they have had about this topic. I just have one question and goes to Dr. Hahirwa. We have just seen within the presentation the role of University of Rwanda through innovation and research in pharmacy. Just I know that also you are part of University of Rwanda, but I just want to ask, like, for NPC, the regulator of our profession, what are the role of NPC to encourage the pharmacists to involve in research, and what are you doing to empower the student? Because I think it's in your duties too, since they are doing the indexing, so that you can encourage them and motivate them to participate in research. I'm asking this because one day, as a president of RPSA, I was asked if there are students who have projects of doing research, and when I evaluate, I found like we don't have one. Who are, okay, pharmacy students are not encouraged to do research, to involve in research, and my testimony is the moderator, because we had that thing together. So the role of NPC by encouraging, because I have seen the side of UR. Thank you.
So we can have one more question from this side.
Thank you very much. I would like to appreciate the presentation past, which was really interesting, bringing on table the innovation, specifically innovation in pharmacy. The HOD, I would like to quote, if I'm not mistaken, that the presentation past has been even passed for, I think this 1 year past, and you were mentioning that this new, this innovative curriculum is really to be implemented, and this is almost the same thing said. I would like to hear from you, like the students in the room, the pharmacists, and even those who are sharing the same responsibilities. Can we be sure that to what extent that this new curriculum is going to be implemented and start to be facilitating students? The next question, I quoted from the presentation that teachers are fundamental elements of a successful education. Since my entrance to the University of Rwanda, specifically the pharmacy department, we used to have, if I can say, at each academic issue, we used to have a challenge of lectures. Challenges of lectures. We have one from maybe the Department of Medicine, who is coming to deliver courses like immunization and what. This issue of lectures, who are fundamental elements, is really a challenge to our department. I would like to hear from you, what are we doing as the pharmacy department to really equip ourselves to this gap, so that maybe in the future periods, we have a number of people, or a good significant of numbers of individuals who can really support the pharmacy department to deliver this knowledge to the younger pharmacy professional. Thank you.
So I think you can go ahead and give answer to those questions.
Thank you for the questions you raised. Yes, I started by your questions about nursing care and aids in pharmacy. why it was removed while it was so important for pharmacists. Yes, we are department. We are not independent. We are under university and we are public servants. At a given time, we experienced a shortage of lecturers at university, especially in our department. As you know, we used to be in Faculty of Science, and we moved to the Faculty of Medicine, and it happened that we experienced a problem of integration, either from science faculty where we came from, and to the Faculty of Medicine where we came to. And it was a very difficult period we experienced, and we were dependent, like he said, to the medicine and the science faculties. We didn't have really our own staff. We used to have only 2 staff in our department, while most of our staff were understudy, and we ran the department. Some of you may be graduated in 2008 and 2007, and we were the 2 staff, me and Prof. Kadima in the department, and it was the time we had a big number of students, around 60 per year, and we managed to graduate students. And once we came to the medicine, the first year and the second year, the first year of pharmacy and the medicine, we were obliged to have the same courses because we were not integrated well, and the lecturers from medicine didn't want to duplicate models they gave to our department when we were at science to duplicate while we are with them. We combined, we decided. And when it comes to the medicine, to change the program, we were obliged to follow them because we had no other alternatives. And this is why first aid, maybe it was shifted from the first year, and it was changed, the name was changed, and we were not able to follow. This is when we stopped the mathematics, the physics, and some time chemistry. And because we decided the chemistry is so important for pharmacists, we were obliged to move fundamental chemistry in year 2 together with advanced. Those were administrative changes which we managed. This was also innovation, otherwise we should even close the department. But we fighted and we managed to graduate students who can afford, be able to adapt to changes on the field. And what I can say, this is why we brought back, when we had the opportunity to revise the program, we know it is important, we brought it back, and we expect to have our own lectures. As we have a nursing department school, we can arrange any time and have lecturers who can deliver that model. And we have facilities, we have a simulation lab where students even should practice on themselves. In addition, when you said pharmacy students are not engaged in research, it's a problem. Because I'm helping medical students in their training in research. They realize that they don't have enough support in research, and they contact me. I organize every month a research session with them. But I was asking why pharmacy students don't use that opportunity to come to me. I'm available, and I help medical students in training. We have I don't know if it's every month or where they want, they write their proposal, I help them, they send it to me. I organize many seminar sessions on research. Now we are on literature review, but no one from pharmacy who can, if you organize a seminar like this, you can invite someone who can deliver all those missing skills during those opportunities. under your associations, like a medical student did. Yeah, what we are cultivating into you is to have the skills of identifying your need and found the solutions, because you can't have everything in class. You have also to be innovative and found the solutions. And on the question, the Emmanuel's question, Emmanuel, you said that you expected a new curriculum to be implemented. It's still under process of approval. It's administrative process. We don't know really. It's a problem, but we were expecting to implement that curriculum in 2 years ago. But with COVID, there are new emergency situation online, Moodle, and the approval of the new curriculum was stuck somewhere. But it is on our mind that there is a need to revise our curriculum and to implement it as soon as it is approved. And the last question, Emmanuel? Yeah, what we are doing at the pharmacy department, it's that, for example, in pharmacy, what we did is that we are trying, because the teacher is the important element in innovation, what we are doing is, according to the quotation, that what we did, what we give and how we give it are also important. Our teachers are following. Now we have 4 who got a certificate in high learning education to teach. This is a good thing. Now we are learning how to teach and what to teach. How, and they are important. 4 out of the lecturers we have that certificate, and it's good. They know how to organize, which good method, and so on. In addition, most of our lectures now, they are upgraded their level. Now we have all have a PhD degree. Only one is under master's, but it's enough. We don't have it. Tell us we need those, but I think we upgraded our level since 3 years. We have a good number of lecturers, and the other are getting promoted into academic rank. This is also something which convinces that we are building our department, our capacities, in order to keep method and the techniques for contributing to research. And then we are also building our laboratory, and we expect to have a different area of research soon. We also have good collaboration with international institutions, and we are trying also to send our students outside to be exposed to modern equipment. Soon we will send 3 students to Italy for 4 months, and this is a good thing. It's innovation through collaboration. It's also an innovation in our department. Thank you.
Thank you so much, Dr. Francois. So now, Dr. Inosa, you have... Go on.
Thank you. Just going to tackle some questions which maybe were not tackled. Starting with the question on why pharmacists are not prescribing. Actually, I think maybe this is something that need to be like even addressed with a carefulness, because actually, what is a prescription? So what do we need to prescribe? First, we start by there. I know, yes, there's some few systems where pharmacists can prescribe, but at least for you to prescribe, you need to have let me say, the outcomes of the diagnosis. You cannot just look at the patient and start to prescribe medicines, right? So, first of all, this is how the current system is built in Rwanda. Maybe with the time, because we are now seeing some changes, and some of the activities are now even interlinked and being captured in the scope of pharmacy practice, including maybe administration of some vaccines. Maybe very soon may start family planning product, and whatever services can be like started in pharmacies. But all those need really to be like done carefully, because there are some prerequisites, there are some requirements for this to be done. So for pharmacists, really, it is still difficult. We cannot say today that we need to advocate for pharmacists to prescribe, because we are lacking such a basic basic need or requirements for this to be possible. The only place, maybe even where this is done, is in the hospitals. Not really like in a community pharmacy. You cannot go there and get a prescription, because first of all, you can understand that there will be conflict of interest, because you will be the one to prescribe and give the medicine. This wouldn't make sense, really. At the hospital also, where this can be done, it's where really there is an integrated system where pharmacists can have full access to the patient information. Because to prescribe, you need, like I said, you need to know what the patient is suffering from. This is from really the diagnosis, the comprehensive, being really this direct or the differential diagnosis. But also you need to consider the patient, because the same patient with the same disease may need really different medicines, because you need to consider other factors. So I think really the journey is still long. I'm sorry to say that. But we can still maybe start to advocate, as we talk about innovation, to see how we can now start to have a pharmacist having access to patient information. Because elsewhere this is done through just a simple scan of a card, you can access to the information of the patient. At least from there, though you don't prescribe, you are kind of validating the prescription, because having all the information of the patient, you may really like deliver what is on the prescription, or say, no, this cannot be done. I have to contact the prescriber, and then we decide on what to give. In that way, I think we will be starting really to play a big role in a prescription. Because for me, if I have just to write down or to prescribe, even electronically, some drugs, and if you tell me to choose between just interlink medication or writing them down and validating what was prescribed, I would rather choose to validate, because at the end of the day, you are the one to give a go-ahead to the prescription. I know that in many countries, really, now they've reached that step where every single prescription, at least at the hospital level in clinical settings, is validated by pharmacists. We are aiming to reach there, but this will start by having enough pharmacists in hospitals and other places where such kind of prescription are being done. So this is maybe what I can say at the question. The second one is a bit tricky and difficult. What is NPC doing maybe on encouraging students in research and innovation? Let me first start. It's a good opportunity to explain a bit what NPC is doing, first of all, because NPC is a regulatory body first. Regulatory body to make sure that pharmacy profession is being done properly. It's respecting all the requirement, ethical, whatever kind of, yes. And we are really protecting the profession first, and we are dealing with the professionals. So what we've so far done, we've been able to do first is to capture research in the scope of pharmacy practice. I think for me this is one of maybe giving strength to research, because not only the research outcome, publication and so on are given credits, CPD credits for professionals, but also we are really acknowledging the research as one of the area for pharmacy practice. I think this is one step we've been able to make, but other things really, because we are really working with the different partners, and we are really even encouraging or trying to carry out some researches which can be very helpful to the improvement of the pharmacy practice. I know we are having really different researches. There are still very few, and maybe it's an opportunity even to encourage students who want to work on something which can help us to improve the pharmacy practice in Rwanda, to come to NPC. Come to us, share with us your innovative ideas, and then we will see how together we can implement this. So we are really encouraging much as we can. We are encouraging really student people to have such kind of research, innovation, innovative ideas which can help us to improve the way we are carrying out, we are doing our pharmacy practice. Yeah, I think maybe those were two questions, right? Unless I'm leaving out something else that was addressed to me.
I think those are all the questions that were asked. And because of the time, please allow me to thank all the panelists for the words of wisdom they have shared with us. Please, thank you so much, Dr. Inosa and Dr. Francoise, for the words of wisdom shared with us. And thank you, audience, for the participation. And for those who still have some questions, please reach out to our panelists and you continue the discussion. I know research is broad and education, so please reach out to them. And pharmacists, this is our turn to be engaged in research. And students, you are also part of this movement. Thank you so much.
Thank you so much. I think the panel was interesting. We need to tackle on technology so as to move toward the modern practices. Thank you very much, Dr. Inosa and Dr. Françoise. And as I said on the program, we have one REFT panel, which is on practice and professional development of pharmacy specialists. It is going to be given by Dr. Nyandwi Jean-Baptiste, Dr. Uzabakiriho Darius, and pharmacist Geoffrey. So I would like to welcome, do you have a nice break? Because people need to be energized before this.
I think most of the people here need to sleep because their faces. Okay. What do you prefer?
I think we can have a kind of
A game? A game?
not more than 3 minutes.
Do you guys agree? Are you for a game? Yes. All right. In my power now, I would like to call each and everyone here to stand up. A little bit. To stand up. Now, the drill of this afternoon is very simple, and it is not that tricky as the last one. I would like to ask each one of you to meet one person for the first time in this room for just 2 or 1 minute. Just Just try to see all over the place and meet one person you've never met before or you don't know more of. You're meeting me. Aha, I have someone already here. And please, I'll be picking one person to say what he or she learned from the other person. That would be nice, huh? I'm seeing people who are still stagnant. Come on, move, 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 move. Okay, if you guys know each other, I want you to meet somebody. Come on. Like you can meet the cameraman if you're lost. All right, why not? I'm Paul. Okay. Still, I'll be picking one person. To make this game complete. Who am I choosing this time? A lady? A lady or a boy? A lady or a boy? But these things of gender, eh? Ladies first, eh? Ladies first. Okay, let me pick a lady. Very simple. Your names, and I learned this from the person we met. My name is, and I learned this from the person we met. It's very simple, right? Okay. This time I'll be choosing one person willing a tag. Protocols or ushers? Okay.